John, is it finally time to stop worrying about COVID-19?
Well, thank you very much for that question. And I want to start by saying we're really, NCPA and myself are really happy to be partnering with Novavax to raise awareness about the fact that it's not time to stop worrying about COVID. New strains are appearing all the time. Positivity rates are rising across the country. The good news is new updated vaccines have started arriving in pharmacies across the country. One thing to keep in mind is the new vaccine is targeted toward these variants. It's really important for people over the age of 65, older adults, people with compromised immune systems, people with chronic medical conditions to receive the updated version of the vaccine. Yet, according to the CDC, looking at last year, only 23% of adults received the updated version last year. So it's really important for folks to receive these.
Sylvia, is there something more right now the public needs to know about vaccines like COVID-19?
Well, the first thing is what John covered. We have updated vaccines this season that have been updated to match the variants that are currently being circulated. The other thing that people need to understand is they now have a choice in which kind of COVID-19 vaccine that they can take. There are protein-based options as well as mRNA options. Novavax's vaccine, for example, is a protein-based vaccine. And what does that mean? It's made with protein technology that's the same traditional technology that's used in other vaccines, such as those for RSV and flu, that people commonly take. It's also important for people to know they do not have to take the same type of vaccine or the same vaccine this season that they took last season. And I think finally, as always, the best place where people can go to get more information is to talk to their healthcare providers and also to go to sources of information such as those of manufacturer websites, Novavax.com, for example, and also to search online for where they can get the vaccine at their local retail pharmacy. So go to those websites and get more information. And of course, CDC is also a place to get more information as well.
And Sylvia, do you believe there's still some misinformation out there about COVID-19 vaccines?
I do believe that there is still quite a bit of mis and disinformation about COVID-19 vaccines. We partnered with a vaccine education organization called CVEEP to conduct a research with almost 150 pharmacists and 1,500 adults. And in that survey, the insight was that they said they don't trust the information that's available to them. Alarmingly, it was about 40% of consumers, but also 40% of pharmacists don't trust or understand the information about vaccines and about COVID-19 that are available to them. But the good news is that the survey also told us what we can do about it. And that is to make sure that we give people information about the science behind COVID-19 vaccines and the choices that are available to them. In fact, in the survey, 90% of adults say that they want to have a choice in COVID vaccination. So it's really important for people to go to trusted sources of information like the CDC to get information about vaccination, about COVID, and about the option that is right for them.
And John, are there any special questions that people should be asking their doctors or pharmacists when it comes to COVID-19?
Absolutely. I think the pharmacist is a tremendous resource for information about COVID and the COVID vaccine. That being said, people also need to do their own research, reinforcing what Sylvia just said. So that in combination with talking to the pharmacist, hopefully they can find out the information they need. Some topics that they might want to cover with the pharmacist include, if I've had COVID before and have recovered, do I still need to get the vaccine? Is it okay to get other vaccines at the same time? This is the time of year when folks typically get influenza and pneumococcal vaccine. So is it okay to get those vaccines at the same time. And finally, understanding the differences between the protein-based vaccine and the mRNA vaccines.
And so, John, what's the most important takeaway you'd like the audience to remember about COVID-19?
Sure, there are a few of those. While it's recommended that everyone 6 months of age and older get the COVID vaccine, it's critically important that older adults, people with chronic medical conditions, people whose immune system may be compromised, get the vaccine. Vaccination is absolutely the best protection against serious illness and hospitalizations. And finally, just reinforcing the importance of talking to the pharmacists. They really are your most accessible healthcare professional. And also, if you want additional information, you can go to Novavax.com.
Thank you so much. Appreciate it. Have a good day.
Thank you.
Thank you.